Next speaker is Professor A. Suresh Raman Rao, and Professor Samantha will introduce him.
Professor A. Suresh Raman Rao was the part of the faculty of the renowned Sarojini Devi Eye Hospital, Hyderabad. Right now, he is heading the Department of Ophthalmology of a non-government medical college in Hyderabad. We welcome Dr. Suresh Raman Rao.
Thank you, sir. Good morning to everyone, respected professors on the dais, in the audience. It's nice to be in Delhi and to be invited to speak at the AIOS2025 at Delhi. And the theme of this is for the Forum of Ophthalmic Teachers of India, is the recommended modalities on the ongoing UG and PG curriculum of ophthalmology under NMC, which was adopted at the 48th National Assembly at Chandigarh. So I'm Dr. Suresh Rao, Professor HOD Ophthalmology in a private college now, after retirement from government, from Sarojini Hospital. So I'll be speaking mainly on the OSCE training and the assessment and my recent experiences, especially in the last 2-3 months only after attending the 40 at Chandigarh. So just a brief, just 1-2 lines on this. What's the National Medical Council Commission? It was established on 25th September 2020, replacing the MCI. So that's the date. And competency-based medical education was introduced on August 1st, 2019, and to empower the undergraduate and the postgraduate students with necessary competencies, that is knowledge, skills, and attitude for doing their professional duties. And OSCE is an important part of CBME. So OSCE in ophthalmology is a part of the, and has got standardized assessment format which tests the medical students' competencies in an objective, reliable, and unbiased way. And what is the competency-based medical postgraduate training for MS ophthalmology admitted from the 2021 batch? That is, these students gave the exams in 24 and 25, recently concluded. So the PGs, they were, besides the clinical cases, they had to be aware of fundus photography, fluorescein angiography. This is all from the guidelines, automated perimetry, radiological test, ERG, EOG, histopathology, and other diagnostic charts, just mentioned as other diagnostic charts. And how do we assess them finally? It is a formative and a summative assessment. And the examiners should have the criteria. We should see the students' knowledge, clinical skills, communication skills, professionalism, and emphasize on ADCOM, that is attitude, ethics, and communication, as mentioned by the previous speakers before me. And again, just the last part of the summary. Postgraduate Medical Education Regulations 2023 came into force from 29th December 2023, and in short, it's known as PGMER 23. And now I come back to the examination pattern. So summative assessment, the universities have a role, and it is under the medical institutions to conduct the exams on the successful completion of the PG program. So I'm just telling you, over the last 3 months, I'm in Telangana, so I come under KNR UHS, and in Telangana. So this was the format given to me for my college, and they asked me, you can have a small modification. You can have a small modification, it's mentioned there somewhere. So this format was given to me. I had to modify it now. So when I modified it in February 2025, just 2 months back, I made a worksheet with distribution of marks and duration also. And I had full permission from my management. So I'm not talking of the long case, which I kept for 40 minutes, and short cases, 2 short cases for 40 minutes. But what I'm talking about is the OSCE method. So OSCE, it was for 30 minutes. I made for 30 minutes. There were 6 stations. I could not change the stations. There were 6 stations. You can see there. And the afternoon session, I had fundus and refraction. For again, in some colleges they didn't mention what was the afternoon session. So I had made it 2 fundus cases, 1 refraction, and the total you see, I made it 40 minutes, 40 minutes, 30 minutes, and 40 minutes came to 150 minutes, 2.5 hours. So that's how I conducted the exams in Shahdan, over 2.5 hours, and this was approved by my management. So I won't talk about the clinical was 1 long case, 100 marks, and 2 short cases, 60 marks each. And this was by the university. I cannot change these things. And even the OSCE was mentioned for 60 marks. I could not change it. So I divided this into 6 stations. As per the NMC, 5 stations were histopathology, X-rays, ophthalmic ultrasound, visual fields, and other ophthalmic diagnostic charts. And the other thing is mentioned as blank. So I kept it as logbook here. I had to convince my management the logbook is required because of the history of the previous university. And of course, thesis is 20 marks. And the afternoon session is oral viva, 2 fundus cases, 1 refraction case, and viva includes instruments, drugs, community ophthalmology. In this, you can see the lenses are missing. So the OSCE stations, I'll stick to OSCE stations. So I made it 5, instead of 5, I made it 6 stations because I was given 60 marks. And each station, I made 2 or more charts, which was nicely given to me by my management. They made it, they took color photographs and they laminated and gave it to me. So I made it, so each 10 marks, so 5 questions. I made it objective, 5 questions, 2 marks each. And you can see the first was OSCE was histopathology, as per the NMC guidelines. Second was X-ray, CD and MRI. And third was B-scan, OCT. And the student had to pick up any one from this. And the 4th station was visual fields, glaucoma, neurological fields. 5th station was other diagnostic charts in which I put Octa, I put FFA, and I put HES charts. And the 6th station, it was blank, but I included logbook because a month earlier, when I went to Dr. NTI University in Andhra Pradesh, logbook was given 10 marks, so I included this. And you see, I'm examining my student. I'm seeing her logbook and the thesis, because thesis is to be seen only by the external examiner. So in this, I asked, what did you do for 3 years? The OP and surgical work. And they told me that first year they did this in surgery, second year this in surgery, third came up to doing the bits of surgery. And I also asked them for what are the presentations and what are the awards, if any. So this was all my idea. So and no one said no to it. So, so this is my recent experiences on 7th of February 2025 at being the internal examiner and chairman at Shahdan Institute of Medical Sciences, Hyderabad. Me and the other examiner there, she's from SD Hospital. So the basis of this is my certificate from the revised basic course workshop, which I got for the medical education technology. And I was just seeing today's morning news that this basic course workshop in medical education technology is a must for all the teaching staff. And see that these are the OSCE stations. I separated them by a screen also. And a month earlier, when I went to, as an external examiner to Rangaraya Medical College, Kakinada, under Dr. NTI University at AAP, this is how I was given the thing. But OSCE, you see, the last column is 100 marks. I could not change it because this comes from university. So I kept it at 100 marks. And being the senior most, you can see the 2 internal examiners didn't say anything. And me, I just made it into 100 marks. So I just kept five stations. So 5 stations, 100 marks. I made it 20 marks each for each OSCE. And logbook, you see separately, is given the 10 marks. So it came in under my criteria. 10 marks is given, logbook is given there clearly. I can't change it. And as someone said, this is the new criteria. It was 400 for theory and 400 for viva. And that is 300 for practicals and 100 for viva. So it comes to 400 each. So you see, previously it was 300, now it's 400. And so this is PG exams. Now I'll talk about the UG exams in short, just which I, again, this comes under Undergraduate Medical Education Board of the NMC. And OSCE was first introduced for the 2023 batch. That was 2 years back. Batch admitted in 2019. And you see here in short and small in center, there is 5 stations in the center. No, I can show it here. There are 5 stations in the center. It's given there. So 5 stations or 5 marks each, 25 marks, and duration is 30 minutes, along with 1 long case and 2 short cases. And again, I used my method of teaching, which no one said no. So I kept 5 OSCE stations, 5 questions, 1 mark each, 25 marks. So the 5 stations, as per the NMC, which I just picked up from the guidelines, were one was data interpretation. Data interpretation means we give the students just like a case. That was like in COVID time, there were no cases, so we used to give charts, clinical symptoms and signs, and we asked them to give the data. So that was one station. Second station was charts, and again, if you go through the CBMA guidelines, these are the cases which should be kept for the undergraduates: allergic conjunctivitis and xerosis, corneal ulcers, glaucoma, anisocoria, subconjunctival hemorrhages. And the third was skills demonstrations. If you get a patient there, or instruments. So I kept instruments as IOP or funnels, and others we asked them to demonstrate skills of visual acuity, pupillary reactions, and ocular motility. And number 4 was prescription of glasses, because the lenses are removed. So I made this like this. I made a chart like this and asked them to tell me what refractive error and what are the lenses used. And number 5 is the counseling. The counseling, again, I keep a chart station asking how do you counsel a patient, a child having myopia, and how do you counsel a cataract surgery patient going off for surgery having sugar and BP. So these are 5 stations, and as the previous speaker said, we have to see the attitude and we have to see the AdCom also. And this is there, it's a part of the recent things. And the last 2 slides. So here you see, this is the UG examinations in my 3 colleges, which I was the main examiner, with my other colleague being Dr. Sikandar being the other examiner. So I gave the individual examiner worksheet. And you see in 5, I'm talking OSCE only, the 5 OSCE stations, I asked the examiners to mark themselves, and then I compile it as a compilation master sheet. This is all under the NMC guidelines. So when I compile the OSCE station or anything, I take an average of all the marks of all the examiners. That is one method. Or if I divided the students, like if MBBS students are 25 per day, then I make it, I take a total of all the examiners. So either you take an average marks or you take a total and then divide it like this. And my last slide is the concluding remarks. The OSCE stations are, which covers more of the Ophthal subject in a well-structured format. And it assesses the students' knowledge, competencies in all the 3 domains, that is psychomotor, affective, and cognitive, in an objective and unbiased way. And the training for the OSCE is to be given to students during their clinical postings. And in this way, I got 2 assessments: the formative assessment, which should be held regularly during internal examinations, and the summative assessment at the completion of the PG and UG program. And what we found out was it becomes more meaningful and more beneficial to the students. And if you see one of the students here, here, this girl here, after the exams in Kakinada, she came and sent a message to me saying that she topped the university. So in MS Ophthalmology, that is the Andhra University, under Dr. N.T.A. Uchas. So that becomes beneficial for her also. And I took an assessment from all my examiners. They were very satisfied with this method of examinations.
Yeah.
Thank you all.
Thank you, Professor Rao. I think you implemented it for the first time in your institution, right? This scheme of examination. Yes. For the first time you implemented.
Yes, I had a free hand being the senior most. I'm having about 33 years experience.
So were there any kind of difficulties or any special?
No, all were very happy. All were. See, you can see all the examiners, photographs, the internals, externals, all said yes, it's the best method. In fact, a lot of them took my papers. They said, we want to come. Not only Ophthal, they said even ENT, surgery, medicine. They said your format is very good.
Yeah. And what is the like feedback from the students? How do they feel?
Students, I said, see, one of the students emailed, she sent me that I topped the university.
No, but the process of examination, are they comfortable? Or
yes, they're comfortable. They're comfortable because they get a chance to get more marks also. Yeah. Because it's structured, it's divided. They get more marks.
Thank you.
Thank you all. Thank you.
very good presentation, Professor Rao. I just have a few questions for you. OSCE, yes, I mean, was started because our traditional, assessment methods were not uniform, they were
Yes.
not structured, and they were not transparent. There was a lot of bias,
Bias.
examiner
Exactly.
bias, patient bias,
Exactly.
But the beauty of OSCE lies in feedback. So have you included feedback as part of your OSCE stations? Actually, I, started using OSCE in the year 2003, 2004. Yeah.
Was it
we-
permitted? Was it permitted that so many years back? OSCE?
No, I
don't think.
started it as part of formative assessment.
Was all this there those years?
Yes, yes.
It was there.
Yes, it was there. In fact, that was my Jipmer Pondicherry project,
I'm from
NTTC,
Pondicherry.
yeah, NTTC
Okay, that's it.
project.
Okay, that's it.
And then we continued it, and I mean, that college is still continuing this,
Okay.
but we started it as formative assessment.
Fine.
Because in summative assessment, there are so many limitations. And unless
Yes.
you have more of performance stations and which is clubbed with feedback,
Summative were limited by the university.
yeah. Now, actually, with CBME, they've made it compulsory. But for postgraduate, for undergraduates, it's fine. For postgraduates, I personally feel that workplace-based assessment is better because OSCE is done in artificial setting.
Yes.
While workplace-based assessment is done in real-life situation, like in outpatient department or OT or emergencies or IPD,
That's why
where you are assessing their performance and not just competence.
Excuse me,
Thank
that's
you.
why
In
I.
OSCE, we are assessing only the competence.
I think
That's why I
we can
included.
discuss.
That's
So
why I
that
included
is-
logbook
yeah.
also. I included logbook.
I
It's a
think there are
dynamic logbook.
many-
We should
many
know
things
what
to
it